Hello, and welcome to Glanbia's Dairy Focus. With the calving season now well underway and the calf housing starting to fill up quite quickly, it's important to keep your eye out for the first signs of calf pneumonia. After calf scour, calf pneumonia is the second biggest disease problem in calves. And some of the telltale signs that calf pneumonia is starting to creep in would be obviously the odd cough, snotty noses, runny eyes, and calves not having a great appetite. Compared to calf scour, where the focus is really on the hygiene of the calf's environment. It's the drinkers, the milk feeders, the feed troughs, the straw bedding and so on. For calf pneumonia, the air quality and calf comfort are also important. So first of all, you want to reduce the moisture levels in the shed, and you want to have fresh air coming into the sheds. So good ventilation without causing drafts at the calf level. So again, deep straw bedded sheds with nice dry straw is important, so the calves can really nest themselves in and keep themselves warm, dry and comfortable. But the fresh air is an important piece here, and the fresh air reduces the viral and bacterial load that might be in the air that the calves breathe. Something that might push up that load is shared airspace with older stock, and that could be yearlings, it could be adult cattle, but it could also be in those herds that have autumn calving seasons. It could be the autumn-born calves. Those calves that are a good few months older now than the spring-born calves have already been in the housing for a few months. They may have gone through an episode of calf pneumonia, or they may have been vaccinated before Christmas already. But at this stage, they could be a huge source of viruses or bacteria that can cause calf pneumonia in the spring-born baby calves. If you want to find out how you can assess the ventilation of your calf housing, you can watch the video at the end of this episode that will show you how to use a smoke bomb test to assess the rate of fresh air being introduced into your calf shed and how quickly that air is refreshed and being replenished. Now, on top of good colostrum management, there are a few additional steps that can be taken to improve the calf's ability to fight off the viruses or bacteria that can cause pneumonia. And vaccines play an important role there. There are some vaccines available that can be given to calves of less than a week of age. And there are also intranasal vaccines available that can be given to calves of a young age and give very quick immune responses. The benefit of the intranasal vaccines is that when calves have been given immunity through the colostrum, the intranasal vaccine will work in parallel to that immunity from the colostrum. So they go side by side, they don't interfere with each other. However, one of the downsides of the intranasal vaccines is that they don't last very long, usually 2 to maybe 3 months. Intranasal vaccines can be given to older stock as well, and because they give such a quick immune response, they're actually ideally suited to give to calves or older stock on the cusp of an outbreak of pneumonia potentially. Whichever way they're given, they need to be followed up by an injection of that vaccine, especially if the vaccine is already in place as a protocol in the herd, or if it's something new that's being introduced to the herd because of a new introduction of disease. Intranasal vaccines should be followed up after 3 months with an injection of that vaccine. If you want any more information on calf pneumonia, please talk to your local Glanbia representative or log on to glanbiaconnect.com.